Hi, Dr. Dan here again. Today I'm going to talk about one of the more difficult diagnoses, and that's ovarian cancer. If either you or a relative of yours has ever been met with the challenge of ovarian cancer, you know what a scary diagnosis this is. Here at Rocky Mountain Cancer Center, we have all the necessary specialists to help you with your treatment, and we have all the facilities necessary to help give you the best possible outcome. We have clinical trials available as well to help you through your journey if that meets your needs. As you've probably heard, ovarian cancer is probably the most difficult tumor to make a diagnosis on because most people who have it have very few or minimal symptoms. The symptoms are typically very vague, such as nonspecific abdominal distension or bloating, urinary frequency, change in bowel habits, some reflux symptoms, nothing really specific that would make you jump up and down and go, oh my God, there's got to be something going on. And that's why, unfortunately, the diagnosis usually is delayed for months, even after seeing your primary care doctor, who writes it off to reflux or IBS. So my recommendation would be is if you're having any of these type of symptoms, especially if they're not getting any better after a couple weeks, go see someone. Make sure that they at least do a pelvic exam to feel your ovaries and at least order a pelvic ultrasound. That's one of the easiest way of looking at ovaries to see if there's any masses on them. If in fact they tell you that you do have a mass, and especially if you're postmenopausal over the age of 60, where the incidence of ovarian cancer goes up, the next step is usually going to be to see a surgeon to have that mass removed. Generally, what we know is patients with ovarian cancer or suspicion for ovarian cancer usually do better when they see and are treated by a gynecologic oncologist who is specialized in this type of cancer care. They know what to do, they know what type of biopsies need to be accomplished at the time of surgery, and they know and are experienced in removing things that need to be removed, such as small bowel, colon, sometimes the spleen or part of the stomach. All these type of surgeries require a lot of training and expertise to know when and when not to do them. So my recommendation would be to please see a GYN oncologist who can help you through your journey. Again, once the diagnosis of ovarian cancer is made, usually the decision is for surgery, and the goal of surgery is to remove all the tumor that's there. If that can be done, then that puts you in the best category of responding well to chemotherapy after surgery. After the surgery, the chemotherapy usually will go on for about 6 months. The treatment is usually monthly for 6 months. You'll be seeing genetic counselors to make a diagnosis to see if you have a specific gene mutation that might actually make you eligible for certain types of treatment called PARP inhibitors. We have now a lot of new things on the marketplace for treating patients with ovarian cancer, such as these PARP inhibitors. We have new immunotherapies that are also showing really good responses for patients with ovarian cancer that actually delay the recurrence rates. So people are living longer with higher quality of life, even though that they have the diagnosis of ovarian cancer. So I would encourage you, or if you have a family member that has this type of diagnosis or a suspicion for it, please give us a call. We'd be more than happy to see you and evaluate you and try to guide you through this journey in the future. Thanks for checking us out.